Hello, my name is Muhammad Hamza Mushtaq, and the abstract that I am going to present today is evaluating the efficacy and safety of iron supplements for the treatment of iron deficiency in patients with heart failure. This is actually a network meta-analysis. So, as we all know, iron deficiency is a very common condition everywhere in the world. It affects about one third of the population, and especially for heart failure patient, it becomes particularly important because it's very prevalent in this subset. In heart failure, iron deficiency can actually worsen the symptoms and make things worse for these patients. The symptoms is fatigue, shortness of breath, and it can also lead to higher hospitalization rates and increase the mortality. So iron therapies, intravenous iron therapies like ferric carboxymaltose and ferric derisomaltose, they have shown to effectively enhance symptoms and improve the quality of life in patients with heart failure. This meta-analysis examines the safety and how effective these iron treatments are. The objective of our analysis is to give us some insights into the comparative effectiveness of these iron formulations in improving the symptoms, and how this improves the functional capacity of these symptoms, and how this can improve the overall quality of life in these patient groups. Now, the methods that we have used to do this comparison is by using PubMed, clinicaltrial.government, and Cochrane library databases from inception till May 2024. So different studies have been identified, and statistical analysis were then conducted by using R software, 4.1.2 version, and 24 RCTs were actually taken into consideration, that had 11,333 participants. Now, the results of this network meta-analysis have shown that all-cause mortality risk reduction was not observed with ferrous carboxymaltose and ferric derisomaltose. Ferrous carboxymaltose actually significantly reduced the composite outcomes for hospitalization in the patients with heart failure, and it also reduced the cardiovascular mortality. The Kansas City Cardiomyopathy Questionnaire increases with the use of ferrous carboxymaltose, and the left ventricular ejection fraction improvement was found to be high with iron sucrose. For the Minnesota Living with Heart Failure Questionnaire, the MLHFQ, both ferric carboxymaltose and ferric derisomaltose, both of them actually showed most improvement. In peak oxygen consumption, PVO2, none of the therapies actually showed any benefit. The 6-minute walk test results, they were identified with the ferrous carboxymaltose as to be most effective. So, to conclude this meta-analysis, the highlight would be that the ferric carboxymaltose is a very promising iron therapy for heart failure patients with iron deficiency. However, the clinical decisions that we take, they should consider the patient factors. It should also be taking tolerability and the cost effectiveness into account. So we also have to take this into insight that further long-term studies are actually needed so that we could optimize the treatment strategies and to prevent hospitalization and ensure the safety of IV iron supplementations in patients with heart failure. Thank you so much.